everybody. How are you all? I hope everybody had a great weekend. And it's Monday tomorrow. I wish you all a very good week ahead. We have a very interesting topic to discuss today, and it is about epigenetics. It is about acupuncture, Chinese medicines, and nutrition. Epigenetics is a very interesting subject and about which we have not spoken earlier before. So let me invite Dr. Ashley Bickman directly and tell you what actually epigenetics is and how can it, what's its relationship with MS. Hi everyone, thank you so much for joining us. I'm waiting to connect. Hi doctor.
Hi, how are you?
I'm good. How are you? Good morning.
Good. Good morning. How are you doing today?
Oh, fantastic. Thank you so much. Thank you so much for accepting this request and being here at this short notice.
Of
And
course, yeah.
we've seen your videos, and epigenetics seems to be a very interesting topic. And I think you're an expert in it. So we thought of inviting you and asking you what exactly that is and what can it be, what can be the relationship with MS. But before doing that, if you'd like to briefly tell about yourself to the audience here. So many people are watching you already.
Oh, sure. So epigenetics is basically the study how certain mechanisms in your lifestyle affect how the genetic code is expressed. So this is usually food, your diet, your nutrition, how you exercise. A big piece is also what kind of toxin exposure you have and how well you can detox from those. Everyone's a little different with that. And then basically also there's other things like how we deal with stress and emotional trauma. So your genetic code never changes or the DNA never changes, but our expression does. And that's all in reaction to our environment and lifestyle.
Okay. And what is its relationship with the genes that we have?
So basically we all have, the set of genes, but what I love about this is that it really does make what we do changeable. So you don't have to be destined to get something just because your parents had it or your grandparents had it, or even, if you've done some specific testing and it looks like it might crop up. Basically, it gives you a lot of control to change your diet and lifestyle and certain factors to minimize your risk to someone who doesn't have that risk.
Oh, really? Because like we see so many people with blood pressure or diabetes, they
Yes.
say that their parents had it, so they will definitely have it. And
So,
also,
yeah.
sorry.
No, I was going to say that's usually too because our habits are passed down by our parents too. Most of us basically use our habits, like the way we eat, things like that, they all get passed down and we don't even realize how many of those subconscious patterns we have. And that can be emotional too.
And what about doctor, multiple sclerosis? So many people, like we have, people joining us, and they say that their siblings, all the two siblings, or the three siblings, they all have MS, or someone
Yep.
in their family, their uncle had MS. So is
Yep.
it again because of the lifestyle pattern, or because, people do not even want to talk about MS for that matter.
Sure.
So because of not telling what that someone had MS and the future generations don't take care, is because of that? Or how does epigenetics connect with MS?
So a lot of it actually can stem to from these layers of different either environmental toxins or trauma and things like that that can be passed down and how the body reacts. And so what I found is a lot of times people's MS symptoms improve quite a bit by making these huge overhauls in their lifestyle and removing certain pathogens kind of one by one. And so a lot of the symptoms are minimized a lot.
Okay.
So that kind of goes with this sort of toxin overload that so many people are privy to. And that happens a lot in families. A lot of times in a family, multiple people get the same disease, and it could be exposure to, like radiation or metals or in the groundwater and things like that. and a lot of environmental toxins. A lot of kids used to play like in the pesticides.
Yeah.
You know, if they grew up in an agricultural area, they're exposed to a lot of things, and those all cause a lot of neurological damage.
Yes. Doctor, if I have to say that someone can, help themselves by, controlling their lifestyle. So, what
Mm-hmm.
all elements are there in the lifestyle that one can take care of? And supposing if someone has MS now, tomorrow
Mm-hmm.
they're going to have children, for example.
Mm-hmm.
So, what kind of changes or what kind of things they should take care for their children so that they are less prone to have a disease like MS?
Sure. So I'm a big fan of of doing these testing to see what's there, what you're working with, because not everybody's pattern would be the same. So I often find in a lot of clients, there's like toxic mold in the body, or
Okay.
like I said, or the heavy metals or environmental toxins and different things like that. You can see the levels and then you just start removing them. And so then that's going to impact the health of your, I would just say, unborn children tremendously. So I'm a big fan of this kind of like preconception detox.
Okay.
Um, Even for people that don't have things, but especially when you're concerned of passing something down, there are just things that you can do to optimize your health and see really what you're working with to see what might be some, possible issues that you're trying to circumvent. Obviously, you won't know for sure, but the best thing we can do is try to remove them. And especially that body burden, like I said, especially with environmental toxins, um, it it they're so damaging and usually neurological that it's really crucial to kind of get those eradicated. And there are ways to do it. So it's much better now. We have advanced quite a bit.
Yeah, you know what? I was speaking to one of the MS patients from UAE, and she
Hmm.
said that she has noticed many of the people who have MS around her,
Hmm.
is somehow linked to working in chemical factories or
Uh-huh.
such kind of
Yep.
environments.
Yep.
So she said maybe that is a cause of MS, but we see that people who are models or working in finance industry or various industry, even they do get MS. So
Yeah. Well, that's
yes,
the thing is our world right now is so toxic. And so
yes,
that's the thing that I found with the genetics is that some people are able to handle those toxins better and
yes,
others aren't. So then, I kind of you give the example of someone being more like the canary in the coal mine where there's someone that would, well, that one they would die, but it's basically they have a lot of symptoms where you could send somebody else in and they can handle the toxic load. It might come down later down the road, but people their buckets are full. And then once it's overflowing, basically just all of these symptoms come crashing and you end up with some sort of often neurological disease that's quite strong. So MS is one of the ones, like I said, the environmental toxin tests that I run is usually so high, and a lot of the pesticides and agricultural chemicals are very much linked with that.
Doctor, if I have to ask you, are there any kind of test for epigenetics that someone can do, and what are they like? How can it be done?
Sure. Basically the traditional test is just it's a cheek swab. And I have a kit that I use that I really like. It also tests again, like how people process certain chemicals, toxins. There's areas to look at for the best food and supplements, how you sleep and
Oh,
hormones, and then toxicity levels. So like I said, a lot of times what I find is people aren't able to process the toxins as well, and those are the ones who are usually the most sick.
okay, okay. Doctor, the other question which I have in my mind is what is exactly detox? We talk a lot
Hmm.
about detox
Oh
and
yeah, sorry.
detoxing our bodies. What
Yeah.
exactly that is?
So basically, kind of when our bodies, intrinsically are able to get rid of quite a few things on their own, as long as things are functioning well. So unfortunately, kind of in the world that we live in, basically just from the skincare we use, our environment, like I'm in Los Angeles, which is a lot of chemicals in the air and in the ground. And basically what we what we need to do is be utilizing either kind of the right way to eat, but then usually you need more than that. You need either proper supplements and things like that are designed to open up what we talk about are the drainage pathways. So like the liver, the lymph, kidney, and bowel. And you need those really open so that when people do attempt some sort of a detox, which people, you know, they might see something somewhere and decide to do it, that can make people very sick because they're not actually prepared to handle all the toxins that they kind of pull out from their system. So there's a really right way to do it, and then there's a way when people are just, you know, they see something online and then they buy it. And usually the ones that are very sick already, they will feel much worse because the detox, basically there's no way for the body to process that onslaught of chemicals well.
Okay. So, doctor, what do you suggest? When should a person actually go for a process like detox? When would he know that I should?
When?
When, yeah.
Yeah, so I'm a big fan of seasonal detoxes because, you know, you should be changing kind of like the food you're eating every season. And again, it's just a good amount of time. It also though depends, each person is individual. So everybody needs to do things differently and things should be adjusted to each person. So what I could suggest to one person might be too strong for somebody else. And so that's why it's really important to work with somebody who knows what they're doing and to do it properly, especially if you already have MS or some other type of chronic issue. But even some, you know, people, they don't always realize what they're going to kind of shake loose in the body. And there's no reason to really have to go through all of the difficult symptoms, like some people are nauseous and throwing up and, you know, migraines. And if you prepare your body properly, then the goal is to minimize those reactions.
Okay. Doctor, I just want to know that, so for example, if someone is going for detoxing, so is it that everybody, you know, can do it, or it also depends on the situation, the condition the person is in? For example, someone is on a wheelchair or the body is really weak. Can that person also go through this kind of process, or it all depends on the age group or the kind of condition he is in?
Yeah, every case should be looked at independently, but there's always some sort of way, because if someone even is more weak, maybe they would just have more detoxifying foods. You know what I mean? And that would be much more gentle. But again, then there's also foods that support like the liver and the kidney and good digestion. And so there's a whole wide spectrum of what can be considered detox. And again, yeah, somebody who's wheelchair bound or older is going to be doing something completely different than someone in their 20s or 30s that's healthy and robust. And sometimes it just is the dose of something or even just the exact products.
Okay. Doctor, I can see I'm already getting some questions, so we'll one by one take up some questions. So this is a very interesting question since you're a nutrition expert as well. So the first question is by Wrestle News, and he has written, would you recommend MS patients to get on a plant-based diet?
So I treat nutrition individual for each patient. My main concern really is to bring down inflammatory foods, more like sugar, gluten, most dairy, but it really just depends. To me, a lot of people need some protein from animals in small medicinal amounts, and if it's grass-fed. So there's a whole different, you know, system of recommending any kind of meat versus a very specific high quality grass-fed meat. It's the same, again, most people aren't very tolerant to dairy, but if someone is going to do it, then I would only recommend grass-fed organic dairy. And again, most people can't handle it, but there are some.
So at the end, it also depends from person to person, what suits the person.
Always. Yep. But I would say sugar is not good for anybody, refined sugar. That one you can always count on.
And what about fried foods?
Fried foods? No. Yeah. That too. Yeah. I guess people are really into fried foods. I forget, as someone who I used to love French fries, but most people really hold on to sugar and really don't want to give it up. And that to me can give people a lot of relief and bring down a lot of inflammation and pain.
Okay. I can see the other question by MS with Lolly. She has written, do you know any doctors in VA that does this testing? I'm not sure.
Oh, where is she looking for a specific place? I work virtually, so a lot of people work
Virtually, yes.
virtually now so that we can usually help people in multiple areas, even if we're not in the same city.
Um, okay. Someone has written for address or appointment information. Please, my son has just diagnosed with MS. Well, if you want to meet Dr. Ashley, then of course you can visit her website. And I can
Yes.
see Jelly Legs has already given the details of her website.
Oh. And I always offer a complimentary 30-minute call just so we can
Oh,
see if I can help somebody, if it's the area I work in and whatnot.
that's wonderful. So her website is drashley.com.
Yeah.
So please visit and try to connect with her. The other question I have, doctor, is now when we're talking about nutrition, there are so many
Yes.
diets there,
Yeah.
keto diet, paleo diet, and all these
Yep.
kinds of diet. What do you think about those kinds of diets?
Yeah, so I say this all the time. So it depends on each person. So keto can be very good for people. I think it usually has to be modified. Plenty of people can't handle all that fat. And then again, people get into doing, I guess it's called maybe lazy keto or dirty keto, and then they're eating, like Velveeta cheese and all this bacon. And
Yes.
so when you're trying to do something for a medicinal purpose, your food still needs to be clean. So my, clean eating is to me always the most important thing, as unprocessed as possible. And then again, there's a lot of people who can't handle even certain sugars from fruits and, honey and maple syrup. So that person needs to be eating something different. And that's where I like the genetics. The genetics can give you kind of a good blueprint of what is good for you. And then again, like I said, these things also can change. So at one point in your life, you might need one thing. And then if you've been through a lot of, traumatic experience, or you're having a new health concern, you just need to be open and flexible to changing and not being married to actually like a specific diet.
Okay.
That's usually what I would say. But
That's
a lot of people do best with, quite a bit of plants, a little bit of medicinal meat if needed, and then some fruits, and then good quality fat.
so it's actually means you have to understand your own body and take whatever your
Yes.
body can take care of. Yeah.
Yeah. And one thing I do talk about is a lot of times people, they think that they're craving sugar. I mean, they are, but it's
Yes.
usually the gut bacteria or the candida or mold that's actually craving that. And so once we get those imbalances worked out, then what you naturally would go to would be much more clean too.
Yes, craving is the main issue, especially when a person is
Yeah.
fatigued or feeling weak.
Oh,
They
yeah.
tend to eat something sugary. That is the way.
Yeah, because your brain reaches for a high quick glucose, which is a starchy carb usually, and people always are trying to convince me that they're fine with bread and pasta and that it doesn't bother them. But then they have all of these health concerns, and a lot of those can really be minimized when you change up what you're doing.
All right. I can see another question here on the screen by MS Jellylegs. This is about epigenetics, I believe. She has told,
Okay.
I would be interested to know if there is a link between living in a household of smoking parents, a meat-based diet, and possibly lacking vitamin D, as I lived in the north of England, and she also has MS.
Ah. So I would say between those chemicals and even some of the agricultural chemicals that are used in some of the meat, that it could easily have an impact on that. I mean, the smoke on MS, the smoking is so detrimental,
Yes.
even the secondhand, and then of course, if you were a smoker, And especially a lot of times when parents grew up with kids like that, they were getting those chemicals at such a young age that that's when a lot of things and systems were forming. And so it's really important that they get sort of detoxified, because basically those have been there for such a long time. And that's what people don't realize, is many of these things stay in the body until you actively do something to get them out. So that's why people think like, oh, oh, I had mold exposure, but that was when I was a kid. You know what I mean? And then they don't realize that a lot of the things that happen to them are the
Actually
body's
already happened.
reaction to that exposure when they were a child.
She has also written that her mom has leukemia and her
Oh,
grandma had rheumatoid arthritis.
yeah. So she kind of probably already came in with some genetic weakness, but the thing is that all that probably was is that she had already come in too with quite a bit of toxins or things where she was
Toxins.
susceptible. And like I said, I talk about that bucket being full all the time, and then add on, smoke chemicals and other agricultural, and it's just kind of like a perfect storm of things happening, and the body just can't take it.
Yeah. Even though she also doesn't smoke, but she has already taken it from the past.
Oh yeah. And the thing is too, is people just don't, like I said, one person could handle quite a bit, and then another child, even within the same family, they're, become very sick all the time from it. So it's still very unique, and it has to be dealt with. Otherwise, that's the thing, is that all of these different diseases, that are often environmental based, it's just the body's reaction that it's too overwhelmed and it can't handle what's going on.
Right. I can see other question by Sanjay 90, and he has written, is cannabis good for MS?
You know what? I don't know any particular links with it. In general, the endocannabinoid system I know is very involved, and it's uh, at least it's getting highly researched right now. I I think that there's quite a bit of potential there for lots of different modalities, and again, because of how it can help with a lot of different types of cancer and things like that. I would think that it has a lot of other areas that it helps with, and it helps with pain. So kind of depends on what you're doing, if you're using it for the pain aspects or neurological aspects. And then again, just even within there, there's a whole lot that is kind of like coming out, but there's much more levels of it. So it's not my area of expertise. But I think if people get some relief, and it's a more natural substance that people can use.
Okay. The other question, doctor, I have is about acupuncture,
Yes.
laboratory topics.
Yeah.
And he's written, can you tell us if acupuncture can help MS symptoms?
Yes. So acupuncture is really wonderful for pain, neuralgias, um, and basically just helping the body get back to balance. So it really helps remove blockages in the body. And so what you do is the needles will help kind of, I think of them as like a little lightning rod to direct energy of where it needs to go. And so it's one of the best things we have. I would say a tool that's a natural tool to help reduce pain, and definitely with a variety of MS symptoms. So I would definitely find someone in your area and make that part of your like healing regime that you do.
I can see, tag 18 is written, acupuncture is amazing. Some of us people here have already tried acupuncture and seen the benefits of it. Dr. Ten, can you tell us, like, for example, if someone has symptoms like the numbness and fatigue
Mm-hmm.
and even migraines, does
Yep.
acupuncture help in all those kinds of symptoms, or
Yes.
it differs from symptoms to symptoms?
Well, acupuncture is amazing for all of those types of symptoms. So it, again, like we wouldn't, as an acupuncturist, you don't look at the body as having MS per se. We look at within the Chinese diagnosis. And so we would kind of want to look at what type of migraine, where it is, because they
Mm-hmm.
have different significance for us of what
Right.
organ is affected. But
Okay.
funny enough, we would be working a lot on the liver with all of those conditions. And again, to me, how I pair how the liver goes back with detoxing quite a bit, to me, there's a connection.
So this is all connected. When you do acupuncture, when you're actually detoxing yourself, when you're whatever you're eating, it's all connected, and that's how your
Yes.
body shows. Okay,
Yeah.
that's interesting.
Yeah.
Um, yeah, Tag has shown acupuncture opens up pathways. It's what truly healed my optic neuritis.
Yeah.
Optic neuritis is also healed by acupuncture. That's great. Doctor, I have a question by Misha Bear, 39, and she has written, I'm a vegetarian and wondering if there is a specific food that can boost my energy due to MS.
Yeah. So again, I would look to see if you have sugar, like refined sugars in your diet, I would remove those. And the same if there's some type of dairy that's not super clean. And then, of course, more pigmented foods, like all the high pigmented fruits and vegetables, those are some of the best for energy. And then sometimes it depends if some people have, um, it just depends. If you need some energy from certain grains, that can help. And some people don't do well with grains. So then you just have to know which one you are because, you know, where one substance can help one person, it can be draining for the other. So, for
Um,
example, a lot of
yeah,
people can't do any grains and that creates more fatigue, but some
exactly.
people need some to help them.
Yes. So yeah, I've seen a lot of people complaining about grains, gluten, dairy,
Mhm.
but some people
Mhm.
are just completely fine with it. What is
Right.
your personal opinion about gluten, doctor?
Yep. So my personal opinion about gluten is that most people can't have it. What I've seen, I was working in a practice for about 8 years, and most people were tested for gluten sensitivity,
Mm-hmm.
and they were tested on 17 markers. So it wasn't just, you know, you have it or you don't with a food sensitivity test. I would say only less than 10% of the people had zero reaction to it. So people mostly don't want to hear that. But most gluten is detrimental and causes inflammation and pain and digestive issues. But like for me, for example, it caused migraines. So
Oh,
when I took it out, completely went away. And so people don't always realize too, there's even like a neurological based schizophrenia that's induced just from gluten.
oh, oh my
So
God.
it can have a huge effect on people's mental state and even neurological issues. So to me, everyone should at least try to take it out for at least 30 days and see if any of your pain symptoms or neurological symptoms are reduced. And then, or people too, they have sometimes anxiety and things like that from it.
Oh,
And then another thing is that gluten in general and food sensitivities in general are more of a symptom that something else is going on, like with absorption or with the gut. So ideally, if you're able to heal those things up, you should be able to have things every once in a while. But in general, you know, the gluten that we have now is nothing like what it was, you know,
oh, yes.
100 years ago.
Yeah.
So we've kind of destroyed a lot of our foods and made them so that they're not good for us.
Doctor, there's other thing which there are lots of debates about that, and some people say that it's very much misunderstood, but some people say no, you should not take it, which is soya. Soya is the most
Oh, right,
hated
right.
topic of all. What do you think about that?
Mhm. All right. So, again, on that one, I think because there's so much controversy around it, I still don't recommend, like, if someone has some sort of hormone dependent cancer or things like that, basically, I still tell someone to avoid it. Maybe they could have it every once in a while. The thing with it is most of it, I think it's 90% is all genetically modified. So already that you don't want because that has the chemical Roundup in the gene of the soy. And that is a huge problem. So anytime you were out and you had soy sauce somewhere or, you know, tempeh or any tofu and things like that, that's generally not going to be organic. And so then that's going to be all genetically modified. So that is a huge chemical and pesticide that people are having reactions to. And the only thing is, so if someone wanted to implement some organic soy, what it is, the thought process of it is that basically it could go in and like fill the receptor site of the hormone for something that's like a better, phytoestrogen, plant-based estrogen, as opposed to all of they're called xenoestrogens, which are all of the things that act like estrogen, but they come from chemicals. So again, this to me still comes kind of down to these fake estrogens that are flooding our system from plastic water bottles and, plastic wrap and skincare ingredients, and those are carcinogenic. So that's why, the thought is that maybe if you have some of the good soy, it'll block those receptor sites. But the good soy is actually so very limited, and it would be something that you would have to buy organic, and make at home. It's not going to be anything you bought out. So like, when people get tofu at a restaurant, generally it's going to be the GMO soy. So that's why it's easier for me to just say to remove it as a whole.
Okay, that's quite an eye-opener. Oh my God. Okay, I have the other question, Doctor, by Saras. Sure. And he's written, is acupuncture also helpful in reducing stress and anxiety?
Yes, definitely. That's something that people come to get acupuncture for quite a bit. So there's many ways around it. We have a lot of our kind of diagnostic tools that we use to see what organs might be affected by stress and anxiety. A lot of times we talk about the spleen, which is kind of the spleen and stomach are a pair. And so that's when people have a lot of worry, and then it especially affects their digestion, and they get that anxiety in their stomach. So we have a lot of points that really help for that. And then we work on stress a lot, again, by supporting the liver. And the liver and spleen often need to work together to reduce stress and anxiety because often they're hand in hand, especially now.
Okay. I have another question by Cape Cod Student 30. And he's written, hi, Dr. Beckman. A question. So I am a senior in college and have gotten diagnosed with sclerosis and have tried chiro adjustments and physical therapy for the pain, and nothing has helped. Any suggestions? And any suggestions on treating sclerosis? Tried? Yes.
Yeah, so there are there are some things that you can do. I would have to look it up because I don't remember it. There are a handful of Chinese formulas that work on that. So you're welcome to email me and I can look that up. Again, it's not always the same for everybody, and there's other things to look at, but that's very young to already have that. And so I would want to figure out kind of like what else is happening, because that shouldn't be happening quite so young. But there are herbs to help.
Doctor, this is very interesting, So what are exactly these Chinese medicines, Chinese treatments? Sounds very fancy.
Well, that's like what I love like Chinese medicine, and then there's Ayurvedic medicine. It's these cultures have used herbs as their primary medicine for thousands of years. And so when I went to school, I was most interested in being an herbalist. So in order to be an herbalist, you need to study acupuncture if you want a licensed degree. And so Chinese medicine school was where I went, and they also, food is medicine too. So you have to combine the food, the herbs, and the acupuncture really is kind of part of their whole treatment, and meditation. And so these Chinese formulas are amazing. And it's very interesting because we have our, huge book, which I have just on my desk, that's our basically kind of like encyclopedia, our materia medica of all the herbs, what they do, and how they work together as well. So if anyone loves herbs, the Chinese medicine format of teaching it is, amazing, and you'll be very knowledgeable. Most people don't love the herbs, so they don't really study it. But to me, if you're just giving someone acupuncture, it's not enough. it still can work,
Okay.
but the person needs to be following up with a medicine. So like an herbal formula, because that's what they're doing every day, taking it 2 or 3 times a day. And then that coupled with the food, which again, your choices have a huge impact on how fast you can get better.
That's very interesting. So, supposing someone has done acupuncture, and as a follow-up, if he also follows these Chinese medicines and herbs, the recovery
Mm.
can be much faster in that case.
Yes, because yeah, if you think about if you get acupuncture, let's just say once or twice a week. But again, like I said, whatever you eat 2 or 3 times a day, the herbs you take 3 times a day, you're reinforcing the treatment that whole time, multiple times a day. Where just the acupuncture, you're only going to get that, let's just say even once a week. So it has effects for longer than the time you're there, but you want that prolonged, and by prolonging it, you're just reinforcing it with your habits and the herbs.
Of course. I have another question by Beatoncourt08, and she has written, I work out daily, and due to my fatigue, I take pre-workout. What are your thoughts on supplements, and are there more healthy alternatives to help me work out?
Is it a particular supplement she takes called pre-workout?
Yes, pre-workout. She has
Okay.
not mentioned what
I'm not sure.
exactly.
There's so many brands, and I would say supplements are a big part of what I do. But basically, what I want to always enforce is the quality is really important. And then it's there's definite things often with exercise, there's that delicate balance when you have fatigue of not over exercising to create more fatigue, but to make sure that you're kind of hitting that sweet spot with if fatigue is already a big thing that you're dealing with. You know what I mean? So I work especially a lot with women who kind of like train too hard, and then it can be negative for them on the back end because they've depleted themselves too much. So sometimes your exercise patterns might need to change according to like the energy that you have, and if you're having some sort of flare up or anything like that. And so I think we always have to be mindful of yourself and where you are. But even just walking and getting moving is really important. So sometimes you just need to adjust. But yeah, I think some things can help, but we also don't want to rely on something that gives us a false energy. Like, we often do with some sort of caffeine, or sometimes people use supplements for that. So it's important to make sure that, again, like you're not over exercising.
People also drink a lot of energy drinks, which
Oh,
of
wait, it
course
says it
contain a
has
lot of.
sucralose in it. No sucralose. That is one of the chemicals I really don't like. Sucralose, aspartame, Splenda, all of those are neurotoxins. So you definitely don't want any sort of things they're called excitotoxins. And so they basically cause the neurons in the brain to fire very quickly. And they cause neurological symptoms. So definitely don't use that.
Okay.
There's other
Let's
things.
talk.
People can use ribose, D-ribose for energy. That's a good, or branched chain amino acids. There's a whole bunch of different things, but sounds like not on sucralose laden foods or workout drinks or anything.
Okay. Okay, this is again regarding soya. So Misha Bear
Sure.
39 has written, I was on soy-based diet years ago, and I got breast cancer. And my oncologist told me it was soy that caused it, and that
Mm-hmm.
I needed meat instead. So what are your
Yep,
thoughts in it?
I agree.
Soya can be that harmful, oh my god.
Well, especially so it is a phytoestrogen, which means it's a plant-based estrogen. So that in itself shouldn't be bad. Everybody is a little different, like I said, with how we process hormones. And how we process estrogens. That's something that I look at in the genetic testing that I do with people, not in regards to cancer, but just how you clear estrogens from the body. And so I'm not a fan of eating soy. And like I said, again, most of it, and it has been for years,
Yeah.
is all genetically modified, and Roundup is cancer causing. So already, it's like you're taking a food that's been contaminated. And then people usually implement it and put so much soy into their body because they're replacing meat. And I would much rather have someone eat some clean meat and smaller amounts. And I was vegan before and vegetarian. So I had to switch over because, you know, when I couldn't eat soy or gluten or dairy, it's like there wasn't much left. And I was,
Exactly. That's what
and I
I was.
wasn't doing well. I had so much, you know, low energy. I had mono and Epstein-Barr, and like, you know, it was my acupuncturist. She just said, you know, you need to eat meat. I know that you morally don't want to, but like, look at you, you're not doing well. And so it changed.
Yeah,
But
so
again,
maybe
there's just it's so contaminated that I don't think there's actually much clean soy. I know that it's available. It's just that usually when we replace things with the substitute for meat or things like that, it gets overconsumed, and then anything that gets overconsumed can be potentially harmful for your system.
okay, I have another comment by Scorpio. I had unknowingly mold
Ah,
exposure in the house that I
yep.
moved in a few years before my diagnosis with MS, and that and she had lots of trouble in her life. Her uncle was modern and stuff. So is that can that also be a cause for MS for her?
Yeah. Yeah, mold exposure can be very detrimental. So that's one of the things that I look at and test with clients. Usually, like I said, kind of like this one test that tests a whole bunch of markers called the organic acid test. And then I do a mycotoxin test, which is the mold toxins, and then environmental toxins.
Okay.
Then we can see the toxic load of a lot of different um, areas and see what might be the most prevalent. And often there's layers of a few.
Okay. Doctor, and the problem that I see that most people with MS they face, which is insomnia. So what do you
Mm.
suggest if someone has insomnia, what person should do?
So there are a few different things. I'm sure people have heard of, if you have insomnia, you've probably heard of sleep hygiene. So all of the things about going to bed before 10 if possible, you know, creating a nice environment for that. Wearing blue blocking glasses. I use the ones, I should have them on now, but I keep those on. Using those before bed, using the setting on your phone that at least switches the light. I do that starting at 7 p.m. That's a setting on the iPhone that you can just do automatically. Um, and then there are certain things that people can take. Everyone is a little bit different again. And so basically there are some ones that can help, you know, like some people like L-theanine, some people like melatonin. There's a whole bunch of different options. Some people do use CBD for sleeping when it's more anxiety related. And again, there's Chinese herbal formulas too.
Yeah, so I've heard many people take chamomile tea and some people using essential oils to
Yeah.
help
Oh,
them.
yeah. And lavender essential oil is one of the ones that's is known, I believe, to work almost as effectively as sleeping pills. So again, it's each person will kind of, you know, react better to certain things and just really have a better outcome. So a lot of it's trial and error and seeing different things that will work for you. And again, some people also need to make sure they're not getting up numerous times from like pets or waking up to use the restroom, things like that.
Yes. Doctor, I have two, three more questions on my screen, but we've already crossed 40 minutes. So I want to
Oh,
continue
yeah,
and
sure.
as I
Of
say,
course. No problem.
sure, thank you so much. Okay, I can see another question. I think I've already answered this, but still I'll just read it out. By Bettencourt. She asked me, what is the harmful ingredient found in pre-workouts?
Sucralose. So
Okay,
I also tell
you have
people
already
to
said
avoid,
yes.
yeah, sucralose, aspartame, and Splenda.
Okay. Um, Other question, this is interesting. This is about cupping therapy.
Okay.
So, what is exactly cupping therapy, and does it help in any ways to MS patients?
Yeah, so cupping is really great. It is really helpful for pain, and the premise behind it is that you move stuck chi in the body. So when the energy gets stuck, there's pain. And the cupping basically creates a little bit of a vacuum and a suction. And so then that creates more circulation and blood flow to the area. And that's basically kind of how it works. It works really, really well for pain, and some people use it for detox as well. So it can be used like on the abdomen, the back, legs, anywhere where there's pain. It just needs a flat surface pretty much.
Okay. And if we have to compare acupuncture or cupping therapy, which one do you prefer? Since that also relieves pain and this also relieves pain. So
Yeah,
which one
so
is more effective?
I would say probably for MS patients, the acupuncture would be more beneficial, just because, yeah, it's not that it's more gentle, but it's going to work on the whole body in a different way. The cupping is a bit more centralized.
Okay, okay. The other question, doctor, I have is about MS hug. So MS hug,
Hmm.
as we know, this is one of the most difficult symptoms to deal with for MS patients.
Hmm.
And other thing is seizures. So
Yeah.
seizures and MS hug, can this also be helped by such therapies?
Yeah, I would say acupuncture would be the best, um, just as the regular treatment to decrease symptoms that are ongoing. So they wouldn't
Doc-
necessarily be happening at the time of either, but you would basically use acupuncture consistently to reduce your symptoms of the frequency.
Okay. Doctor, okay, I have to ask this also. So people know that, maybe in some days or maybe because of some reason, they do get this kind of symptoms now and then.
Mhm.
Is it possible that if they are regularly taking treatments of acupuncture or anything, all these things can be avoided, such symptoms can be avoided if they are already doing all this?
Well, I would say it's such a multi-layered approach. Do you know what I mean? I would say acupuncture would be part of one piece of what they're doing. Looking at the levels of different toxins and things like that would be another piece. How you're eating, removing inflammatory foods, incorporating, something that brings more either mindfulness or meditation, gentle exercise. That's the whole thing is we have to treat the whole system, for anything, but especially something that has so many symptoms. And so overall, the more stressed the body is or the emotions are, usually their symptoms get worse. So we need, and all those different facets. So it's not always so easy if it'd be easier if you could just do one thing, but usually, it's a multi-layered approach.
Okay. Doctor, I have to ask you about the current situation that's going on. So it's COVID time, and
Oh
people are
yeah.
scared that it's COVID, and people are coming getting all these treatments done. How are you, experiencing this kind of situation, and what kind of patients come to you with all different kinds of thoughts in their mind?
Yeah, I mean, right now, a lot of things like for people are getting stirred up because also their anxiety and stress is very high. And again, I talk about this with a lot of patients is that, what's going on, it's really deeply rooted anxiety because it has to do with health and safety. And so people, even ones that don't have anxiety, are feeling it and things like that. So to me, this is also a really good time because generally people are home more. They have the time to focus on what they're eating. And they're not, a lot of times people get things that they don't want to have as much, or it's easier because they're always eating out or like out drinking and things like that. They're just socializing or for work. And so a lot of those things are removed. And so it is a good time to pretty much focus on your health and really try to get that under control even more and maybe chip away at some of these layers that, if you didn't know they existed, find someone who can help you. Or if you do, like put in some of these practices in place so that you can start getting a little traction with feeling better.
Doctor, so for example, I know a few people who have MS and they have also got COVID, you know.
Oh, yeah. Yeah.
I mean, is there anything that you can recommend that they can do? Is it maybe exercises or maybe something with their nutrition or having some kind of spices and herbs which can help them reduce the symptoms?
Yeah, so again, it depends on what their symptoms are. There's a lot of different things people are using. a lot of the typical ones for like the immune system, the vitamin C, zinc. I use something called cat's claw. People are using quercetin and glutathione. Some people, if it's affecting their chest and their breathing, people are using nebulizers with oxygen. So I use a product that's like a liquid oxygen. And so there's a lot of different things that people are doing to kind of try to help stop viral replication. And again, so it still, the food is important. So if the breathing's an issue, definitely cut down on dairy, and then the same to make sure and really decrease the sugar. Anything to boost up the immune system, and it helps a lot of areas.
There are also some people whose test has come positive, but they're not having symptoms at all.
Yeah,
they're absolutely fine. So it differs. Yeah.
Exactly. Yeah, and they're finding a lot of those pre-existing conditions and things. Our country in general doesn't value as much a lot of these kind of like we're very overweight, and we have a whole lot. We're a very sick country in general, and so I think that's another reason that we're getting hit extra hard because our system is kind of flawed, and people do rely on a lot of pharmaceuticals and things like that. So we don't have a lot of these traditional ways set in place that people have been doing at home for building the immune system and staying healthy. People kind of, eat on the run, pick up fast food, all of these things.
Yeah. Okay. I can see another question, which is interesting. Misha Berha is saying, do you know of any kind of herb that's good for tremors? I don't want pharmaceutical medicines.
Yeah, so there are different herbs, but again, it definitely depends on the person and kind of why. So I'm happy to, if you want to email me or ask any more specific questions, because otherwise it's too general. And again, the acupuncture helps a lot with tremors. But there's always herbal medications too. But again, they still have to be customized. There's never just like one thing that you would say for an herbal formula, because even if there were 2 or 3 different options, they're based on different reasons of why you have it. And even just saying, that you have MS or whatever it might be, it's still too general to figure out the right formula.
So one has to go to a right professional who knows about this.
Yes. Yeah.
I have another question from Saras, and you mentioned about cat claw. Can you please tell what exactly that is?
Yeah, I even just have it here because I take it every day as part of my immune boosting right now. And it is, it's an herb that really helps with decreasing viral replication.
Okay. I can see MS Jelly Legs has also written in complete answer about what cat is. Thank you. Okay. Doctor, other thing I want to ask you, like,
sure.
Some people, so in MS specifically, they say that you should avoid red meat.
Okay.
And people do, avoid it. Maximum of the people that I know are avoiding it. Like they also say that omega is very good, but but people who have actually moved towards plant-based diet are not getting omega. So there are so many discrepancies, so many different kinds of confusion, what to eat, what not to eat, and all that. How long do you think a person should try to learn that something is suiting them or not suiting them, what they should eat, not eat? I mean, what the cycle should be ideally.
Sure. Yeah, so I mean, there's certain foods that you eat and right away you can tell that you don't feel good. I think that there's certain things that basically that's more usually gut related. If somebody has bloating, headache, indigestion after food, then it's not meant for them. But sometimes they were eating in a rush or on the go, and so that's not a very good base. But if somebody still has overwhelming fatigue, there's a whole lot of different things. Like we look at the tongue. If the tongue is super pale, or if it has a white coat, the person is what we call deficient. And so they need more, it's mostly herbs and foods that boost blood. I mean, you can also still actually just make sure that your levels for iron and ferritin are in the optimal range, not the okay range, because that range is very broad. And there are plenty of women, especially, that when they're on the low side of it, they feel awful and their fatigue can be helped by having more, um, it doesn't have to be always red meat, but just more meat in general. So, I'm still a big fan of bone broths and things like that. So if somebody doesn't want to consume red meat, they can still gain quite a bit of traction from all the other types of meat. But again, it's still, that's the thing to me, like when doctors take out entire food groups entirely for like a whole population of somebody that has a specific disease, it's still not individualized. And so it's not taking into consideration how that's expressing for that person, all of their symptoms. And then again, if somebody has overwhelming fatigue as one of the main ones, they need to look at the different reasons, like with the adrenals, the thyroid, and iron, because some of that piece could be nourished and supported in a different way that could really be beneficial and helpful.
Okay. Thank you, doctor. Thank you so much for your time. It's been 1 hour we have been talking.
Sure.
Time just flies, isn't it?
Yeah, it does. It's lots of fun though.
We had so many interesting questions and so many interesting discussions today. And thank you so much for taking out your time on a Sunday.
Okay.
I'm
No
sure
problem.
you need to, relax and spend the next rest of your day with your family.
Yes. Yep.
All right, doctor. Thank you so much for your time, and it was a pleasure having you here.
Thank
I'm
you.
sure if you have time again, we can do this again.
Yeah, it was lots of fun. I always love chatting about these things. And again, there's usually some tweaks and little gems, that people can pick up. And again, my main thing is always everyone is individual. And so, and again, you're your biggest health advocate, and that's really important. And so you need to do what feels right for you as well. And so just keep researching and learning and doing the best things you can for your body.
Very well said. Thank you so much. And see, everybody is so happy and just giving you thank you.
Oh,
it was
yeah,
a wonderful
and I'm very accessible. So if people have questions, just reach out. And like I said, I offer that complimentary call. I'm always happy to see if I can help, and if not, guide you in the direction of someone else that can too.
Yes, yes. So everybody who's listening, please log on to drashley.com, and you can also register for a complimentary service. And her Instagram handle you already know. It is Dr. Ashley Beckman. Please connect to her, and I'm sure she will be helping you very greatly. And she has been very kind answering all the questions today. Thank you, doctor. Thank you so much for your time.
Of course. Have a wonderful day. Okay.
Wonderful
You too.
day. Thank you. Bye.
Bye.
Thank you all for your time and such lovely messages. And it was great meeting Dr. Ashley today. Yes, please log into her website, which is drashley.com, and also register for a complimentary service. She will be telling you what you require, don't require, and she'll help you with everything that you need. And have a good week. And next week again, we will meet with another doctor. He's a very special doctor again, who has cured himself with autoimmune disease, his own autoimmune disease with the help of diet and lifestyle. So let's meet again and with this doctor. And don't forget to log in to drashley.com for now. Have a good week. Thank you for coming. Bye-bye.